I'm Simon. Today we're diving into a critical topic that affects us all, the transmission of infectious diseases. Whether it's a common cold or something more severe, understanding how these diseases spread is key to protecting ourselves and our community.
My name is Oscar, and in this video, we'll explore what infectious diseases are, how they transmit, and what you can do to minimize your risk. Let's get started. Infectious diseases are illness caused by pathogens, tiny microorganisms like bacteria, viruses, fungi, and parasites. These diseases can be transmitted from person to person, from animals to humans, or through contaminated food and water.
Common examples include flu, COVID-19, HIV, tuberculosis. They can range from mild to severe and can affect anyone and anywhere.
Now let's take a closer look at how these diseases are transmitted. There are several primary modes of transmission. Direct contact. This occurs when an infected person touches or exchanges bodily fluids with another person. For instance, flu viruses can spread through touching surfaces contaminated with respiratory droplets. Airborne transmission. These pathogens can be carried through the air in tiny droplets when an infected person coughs, sneezes, or talks. Measles and COVID-19 are key examples of airborne diseases.
Next, there's vector-borne transmission. Vectors like mosquitoes and ticks transmit pathogens from animals to humans. Diseases like malaria and Lyme disease spread this way. Then, fecal-oral transmission. This method occurs when fecal matter contaminates food or water, leading to infections like hepatitis A and cholera. Blood-borne transmission is from when pathogens spread through exposure to infected blood. This is how diseases like HIV and hepatitis B can be transmitted.
Understanding these modes of transmission is vital for prevention. Here are some effective strategies to minimize your risk. Practice good hygiene. Wash your hands regularly and use hand sanitizer. Vaccination. Stay up to date with vaccinations to protect against several severe infectious diseases. Safeguard food and water. Ensure food is cooked properly and drink clean water. Safe practices. Use protection during intimate contact and avoid sharing needles. And stay informed. Keep an eye out on public health announcements, especially during outbreaks. Infectious diseases have been a part of human history for millennia. From the bubonic plague to the COVID-19 pandemic, the transmission of these diseases can have profound effects on health, economy, and society. But what determines how and why these diseases spread? Now, we will explore the multifaceted impact of disease transmission.
Transmission refers to how an infectious agent is spread from one person or organism to another. The primary modes of transmission include airborne, tiny particles that linger in the air; droplet, larger particles expelled through coughing or sneezing; contact, direct or indirect contact of contaminated surfaces or fluids; vector-borne, insects or animals transmitting pathogens.
Understanding these modes of transmission is crucial in controlling outbreaks. Several key factors influence the transmission of infectious diseases. Population density. In a densely populated area, close contact between individuals can facilitate rapid spread. Hygiene practices. Good hygiene, such as hand washing and sanitation, can significantly reduce the transmission rates. Healthcare access. Accessible healthcare allows for early detection and treatment, limiting the spread. Vaccination rates. High vaccination rates create herd immunity, protecting those who cannot be vaccinated. Environmental conditions. Climate, weather patterns, and ecology can impact vector-borne diseases, influencing their transmission.
The impact of transmission on public health is immeasurable. Rapid transmissions can lead to overwhelmed health systems. Surges in infections can burden hospitals, leading to inadequate care for both infectious and non-infectious conditions. Increased morbidity and mortality. High transmission rates lead to increased illness and death, particularly among vulnerable populations. And lastly, economic consequences. Illness can reduce workforce productivity, strain healthcare funding, and impact economies on a national scale.
Beyond physical health, the transmission of infectious diseases has profound social and psychological effects. First one, social stigma. Infected individuals may face discrimination, affecting their mental health and willingness to seek care. Community disruption. Outbreaks can alter daily life, from school closures to changes in workplace policies, leading to isolation for people. Mental health strain. Fear of contagious and stress of living in an outbreak can lead to anxiety, depression, and PTSD.
So what can be done to mitigate the transmission of infectious diseases? Here's some effective strategies. Promote public health education. Awareness campaigns can inform communities about modes of transmission and prevention measures. Enhance vaccination campaigns. Increasing access and trust in vaccines is crucial for building community immunity. Improve surveillance systems. Time data collection helps identify outbreaks early, allowing for rapid response. Invest in research. Continued research can lead to the development of new vaccines and treatments, enhancing our abilities to respond to emerging threats.
The fight against infectious diseases is ongoing. By understanding the impact of transmission and working together as a community, we can protect ourselves and future generations. Together, we can build a healthier world.
So, how can you prevent the transmission of infectious diseases? First up, let's talk about hygiene. Simple yet effective practices can make a huge difference. Regular hand washing with soap and water for at least 20 seconds is one of the most effective ways to prevent the spread of germs. If soap isn't available, use a hand sanitizer that contains at least 60% alcohol. Remember to be sure to wash your hands before eating, after using the restroom, and especially after being in public places.
Now, let's discuss personal protective equipment, or PPE. Masks are a simple barrier that can help prevent respiratory droplets from spreading. Wearing a mask in crowded or indoor settings is still a good practice, especially if you're feeling unwell. Let's also talk about food safety. Proper food handling can prevent foodborne illnesses. Always wash fruits and vegetables thoroughly, cook meat to the correct temperature, and never leave perishable items out for long.
Another key recommendation is vaccination. Vaccines are one of the most effective tools in preventing infectious diseases. They not only protect you, but also help build a community immunity. Make sure to stay updated with your vaccinations and encourage others to do the same. Now let's talk about awareness and education. Engaging communities through education can empower people to make informed decisions about their health. Host workshops, distribute materials, and utilize social media to spread awareness about prevention strategies.
Lastly, let's focus on healthcare access. Ensuring that everyone has access to healthcare services is essential. Policy changes that make healthcare more accessible can help ensure timely diagnosis and treatment of infectious diseases.
By adopting these practices and encouraging others to do the same, we can significantly reduce the spread of infectious diseases in our communities. Remember, prevention starts with you.
Infectious diseases continue to pose a threat globally, but by understanding how they transmit and taking preventative measures, we can greatly reduce the risk for ourselves and others. If you find this video helpful, give it a thumbs up and subscribe for more health-related content. Thanks for watching, and stay healthy and safe.